The microscopic war, inside the wound. In the first 48 hours, the battlefield is dominated by gram-positive bacteria. These early invaders exploit damaged tissue, releasing toxins and enzymes. They degrade collagen, delaying wound healing. The bacteria set the stage for deeper infection. But the story doesn't end there. By the 5th day, the microbial landscape shifts. Opportunistic gram-negative pathogens, such as Pseudomonas aeruginosa, Klebsiella pneumoniae, and Acinetobacter baumannii, begin to dominate. These bacteria thrive in the moist burn environment and are armed with advanced weapons biofilm formation, antibiotic resistance genes, and virulence factors that overwhelm weakened immune defenses. Transition from gram-positive bacteria to motile gram-negative rods like Pseudomonas aeruginosa, Klebsiella pneumoniae, and Acinetobacter baumannii. But the story doesn't end there. By the 5th day, the microbial landscape shifts. Opportunistic gram-negative pathogens, such as Pseudomonas aeruginosa, Klebsiella pneumoniae, and Acinetobacter baumannii, begin to dominate. These bacteria thrive in the moist burn environment and are armed with advanced weapons biofilm formation, antibiotic resistance genes, and virulence factors that overwhelm weakened immune defenses. The shift marks a transition to a more dangerous, persistent infection. Pseudomonas aeruginosa demonstrates high motility and tissue penetration. Klebsiella pneumoniae often forms thicker capsules, aiding evasion. Acinetobacter baumannii is notoriously difficult to eradicate due to multidrug resistance. In the first 48 hours, the battlefield is dominated by gram-positive bacteria like Staphylococcus aureus and Streptococcus pyogenes. These early invaders exploit damaged tissue structures. They immediately begin releasing potent destructive substances. Toxins and enzymes are deployed to secure the invasion site. Collagen, the scaffold of healthy tissue, is actively targeted for breakdown. This structural compromise delays the necessary repair mechanisms. The resulting damage weakens the defense perimeter. Enzymatic activity accelerates the breakdown of essential tissue components. As collagen dissolves, tissue integrity is severely compromised. This environment actively delays the initiation of effective wound healing. The early stage successfully sets the stage for deeper, more persistent infection. The battle is won by the gram-positives in these critical first hours. The immune system retaliates with cytokine storms, macrophage activation, and neutrophil attacks. Yet the struggle is immense. Cytokine storms ignite the defense mechanism across the affected area. The first line of defense must hold against the systemic invasion. Severe burns often impair local and systemic immunity, reducing white cell function at the primary site of injury. Even the massive macrophages struggle to maintain their relentless engulfing action. The entire coordinated effort begins to break down under the systemic shock. This leaves the body critically vulnerable to systemic invasion, paving the way for septicemia infection spreading rapidly through the bloodstream. The once mighty defense becomes overwhelmed and depleted. The body fights hard, but the burn trauma has tipped the balance. Within days, these bacteria unite, forming biofilms, sticky microbial fortresses that protect them from antibiotics and immune attack. Inside these films, bacteria communicate, share resistance traits, and persist for weeks, making burn infections notoriously difficult to eradicate. Inside every burn wound is not just damage, but a story of survival, adaptation, and resilience. Understanding the microbial battlefield within these wounds doesn't only save limbs, it saves lives. Yet, hope persists. Advances in antimicrobial dressings, nanotechnology-based therapies, and rapid diagnostic tools are revolutionizing burn care. Antimicrobial dressings are key to managing infection risks. Nanotechnology is providing targeted defense against harmful bacteria. These new materials actively combat the microbial threat. Early wound debridement is crucial for setting the stage for healing. Sterile techniques maintain the integrity of the healing process. Meanwhile, lab diagnostics provide the necessary intelligence. Identifying the specific pathogens allows for highly targeted action. Tailored antibiotic therapy restores balance in this microscopic battlefield. The precision of diagnosis translates directly to effective treatment. Healing is a process of reclaiming control, cell by cell. Science paves the way for recovery.